Most of you have probably seen in the news and on TV that this week, the World Health Organization, WHO, has declared a global health emergency due to the outbreak of monkeypox.
Senior health officials in Africa have declared a continental public health emergency over a new outbreak of Mpox.
So not touching anybody that has Mpox.
The rapid spread of Mpox.
Mpox has been reported in the Democratic Republic of the Congo.
But how serious is this? What exactly is this virus? How does it behave in the body? And how is it transmitted? In this video, we'll break down these key questions and more. The WHO's declaration of monkeypox as a global health emergency is a significant step. This designation is reserved for events that pose a substantial risk to public health, requiring a coordinated international response. The decision was made after a spike in cases across Europe, North America, and Africa, areas where monkeypox was not previously common. The global response has been swift, with health authorities implementing measures to track, contain, and prevent further spread. But what makes this virus so concerning? Monkeypox is a viral zoonosis, meaning it can be transmitted from animals to humans. It's caused by the monkeypox virus, which belongs to the same family as the variola virus, the virus that causes smallpox. Monkeypox was first discovered in 1958 when 2 outbreaks of a pox-like disease occurred in colonies of monkeys kept for research, hence the name. However, the first human case wasn't recorded until 1970 in the Democratic Republic of the Congo. Since then, the virus has been found primarily in Central and West Africa, but recent outbreaks in non-endemic countries have raised global concerns. The symptoms of monkeypox in humans are similar to, but milder than those of smallpox. After an incubation period of about 5 to 21 days, initial symptoms include fever, intense headache, muscle aches, back pain, low energy, and swollen lymph nodes. A few days after the fever begins, the patient develops a rash, often starting on the face and then spreading to other parts of the body, including the palms of the hands and the soles of the feet. The rash goes through different stages before finally forming a scab, which later falls off. The whole process can take up to 3 weeks. In most cases, monkeypox is self-limiting, meaning patients recover within a few weeks without specific treatment. However, severe cases can occur, particularly in children, pregnant women, and individuals with weakened immune systems. The primary animal hosts of the monkeypox virus are rodents and primates, but the exact reservoir species is still unknown. The virus can spread to humans from animals through direct contact with the blood, bodily fluids, or skin lesions of infected animals. Human-to-human transmission can occur, although it's less common. It typically happens through large respiratory droplets during prolonged face-to-face contact, direct contact with bodily fluids or lesion material, or indirectly through contaminated materials such as bedding or clothing. While monkeypox is less contagious and generally less severe than smallpox, the recent spread of the virus to non-endemic countries is concerning. The mortality rate for the West African strain, which is currently circulating, is about 1%, compared to the Central African strain, which has a mortality rate of around 10%. What's worrying health officials is the potential for the virus to spread in populations that have little to no immunity. The cessation of routine smallpox vaccination after the disease was eradicated in 1980 means that many people are now more vulnerable to related viruses, like monkeypox. Protection against monkeypox involves several strategies. First and foremost, vaccination is a powerful tool. The smallpox vaccine has been shown to provide cross-protection against monkeypox. In the current outbreak, some countries are offering the JYNNEOS vaccine to high-risk groups, including healthcare workers and those who have been in close contact with confirmed cases. In addition to vaccination, avoiding close contact with people showing symptoms of monkeypox, practicing good hygiene, and using personal protective equipment when necessary are critical steps. It's also important to be informed and stay updated on guidance from health authorities. As of August 2024, multiple countries are reporting new cases, with the highest numbers in areas that have never before seen an outbreak. The CDC and WHO continue to monitor the situation closely, providing regular updates and guidelines for both the public and healthcare professionals. The response is evolving, but with vigilance and proactive measures, the spread of monkeypox can be contained. Monkeypox is a real problem, but with the right information and precautions, we can protect ourselves and our families. If you found this video useful and want to stay up to date with health news and important scientific discoveries, don't forget to give it a thumbs up, subscribe to this channel, and hit the notification bell so you don't miss any updates. Stay curious.